So CO2, it's a wonderful molecule. Monitoring CO2 can tell you a tremendous amount of information about your patient, which is, I think, a blessing and also a curse. Anything from obstruction of the airway, CPR quality, cardiac output, spontaneous respiratory effort, pulmonary perfusion or changes thereof, artificial airway placement, verifying endotracheal tube placement, quality of CPR as well as return of spontaneous circulation, ventilation titration, as well as nutrition titration. As you can see, this is not a comprehensive list, but there's a lot of things on this slide that I think you can appreciate CO2 monitoring will play an important role in this patient population. Specifically, we're going to touch on a few things. Number one, a technology overview. I think it's going to be important to review the underpinnings, the actual hardware that's going to allow us to measure these things in our patients. We're going to talk about capnography, time-based CO2 monitoring, as well as volumetric capnography, that is volume-based CO2 monitoring. And lastly, we're going to look at a couple of studies that I've selected, not because they're the only ones in the literature, but I think that to me they represent an important step in a couple of areas that are going to be really exciting in this patient population.